Hi there, this is Dr. Michael Horwitz bringing you another episode of Podiatry Help Desk brought to you by the Feet for Life Centers and Clean Spa. And today we're going to talk to patient Lisa. I promised you all for a long time, and I've been very busy, I apologize in advance, but I promised you that I would bring you testimonials from patients that have actually experienced cures with remote fungal therapy. We have patient Lisa today on a Zoom call. Lisa, how are you?
Good to see you.
And I was great to see you when I heard that you reached out to me and basically you essentially told me how satisfied you were with the program and wanted to talk a little bit about what you went through. So I'm going to essentially give you a minute or two to just describe how things went for you. She received our package, our black box. The black box, as most clients know that have had the program, have everything that they need to actually affect extreme control or a cure, and most oftentimes a cure of their fungal nail infections. But what we mean by a cure, as you've all learned, is not just the cure that you get because you've done everything correctly and compliantly, but actually you know how to maintain your nails so that you can keep them fungal free. So tell us your story, Lisa.
Thank you. After I received the black box, I looked very carefully at the instructions, and then I started with, I did the preparatory soaks, and then I did the debridement, and I did that several times over a course of probably a month or two. But the initial one was very intensive, and it was shocking, really, how much of the nail came off to get down to the base of it. And then I started with the liquid clear nail twice a day. I did the soaks very religiously, um, the one once a week and the other every day. And then I did the sandpaper once a week, the medicated sandpaper, and then just really kept an eye on the nails to see how they were doing, and made a judgment call when I needed to use the grinder just to kind of get things down a little bit further. And eventually I got it down to a point where they were pretty good, pretty smooth, and then I just continued with the clear nail and the soaks and the sandpaper over time. I started the protocol in March, and probably by October, my nails were so much better. I mean, I even probably by July, I had started wearing sandals, which I haven't done probably in as long as I've had this fungus, which is about 35 years.
You mentioned that you never would have believed how much grinding you could get away with and how much, how how thick your nails were and how different they look. Isn't it remarkable how the nails look so much better even after the first grinding?
Absolutely. I mean, it was shocking, really, just to think that little tiny tool that you send could do that much, and that even just with that initial debridement, they looked markedly better.
Let's talk about the debridement. Were you nervous at first?
I was. I had watched, I think, at least one or two of your videos showing that process, so I just tried to follow that. I tried to make sure, I did it as much as what felt manageable, and then if I thought a little bit more, I would do more, but I didn't go crazy, I just tried to be very reasonable about it, and that approach really seemed to work. But the initial one, it took quite a while, took a lot of patience, and but at that initial preparatory work was
You
really
you
worth it,
were
I
not a
think.
patient that required a lot of hand holding. I do hundreds of these consults now, hundreds of these consults every quarter. And some patients, and there's nothing, I have no problems with them, but they require more hand holding. They have a lot of questions, which everybody should because we're asking a lot of you. We have to assume or at least not assume that you are just because you're compliant, you're healthy enough to do this. Hence qualification process in the original consult. But some people, they just don't know. When you did your grinding and you learned the preparatory technique, did it give you more confidence? Because obviously we're not just asking people, for you out there that are watching this video, sort of scratching your head and going, should we do this or should I do this? Should I make my husband or wife do this? Is usually the question. But the big issue is you know, um, there is a certain amount of preparation that's very important to get a sterile field and a non-abrasive field on the skin around the nail. How did you feel about that process, and how did you go through that process? Did you soak your foot first in the Tolsolin soak?
I did. I think I did the active conditions soak first, and then I think I did the daily soak once. Then I dried them off. Then I put the antibiotic cream on them, let that soak in a little bit, and then I started the process. I found it helpful to do it outside. Um, it was a nice sunny day, which made it a little bit more pleasant. And then I just started. I went one toe at a time. If I felt uncomfortable, I might put a little bit more of the ointment on just to make it a little easier. And that did
And
help a
that's
lot
that's the
too.
biggest part. That's the hardest part, isn't it? After that, it seems like everybody's, off to the races. And so it's almost baptism by fire, for patients that come in with this problem. And that's why the consult and the black box is so important. Did you have any issues with? I'm going to just show the fungal nail culture. What I explain to patients is when the best time to do the culture is during the massive grinding, because you have so much dust that you're grinding off the nail, you're able to do the culture. The culture is provided in the form of a slide that looks like a slide, but it's actually a double stick tape with a cover on it. How did you do with that?
That wasn't really an issue at all either. I mean, that like you said, there was so much that came off of the nail. It wasn't hard to get any of the material.
Yeah, and it basically gives us a lot of certainty about the, uh, the condition that you have. So right now, you're probably in maintenance, I assume. I saw your nails; they look really, really good. But again, it's this is the art versus the science. It's what a lot of people don't understand. There's different types of people out there in the world, and some people think that everything is so black and white. And in this arena, what we're really what we really are talking about is art and science, which is medicine. And the art comes in, exactly. It's not a matter of the cooks in the kitchen and you have to have a test tube or exact measurements. It's really about certain factors that make a difference, that you have to put into place if you're going to have a go for a mycologic cure. And those factors have to be in place. And once you get all these factors in place, you're off to the races. I often tell patients will ask me, I do have a friend that has a laser, or a doctor. I can get laser. Should I get laser? And you can guess my answer is usually, well, that it's not necessary that you get laser in all cases, and it only adds to the speed of your recovery. In other words, all laser is a harmless radiation that's poured over the nails. I use it in my office. My patients really appreciate it. I offer laser packages. It really helps to prophylax after we do get them into a cured state or a really well-maintained state. But that said, and I think your testimony for this, you don't need a laser. You do need patience. And with patience and the right process, I think I haven't seen too many people, and I've seen some terrible nails that have brought nails to me that we couldn't really control. So you were a good candidate. We saw your nails. We did your consult. We got pictures of your nails. We knew you were a good candidate, health wise, and everything anything else. There are candidates out there that people should know are just not good candidates for this, and those are candidates that are extremely unhealthy, peripheral vascular disease. You can be type 2 diabetic, that's fine, but if you're way out of control on your blood sugar, uh, you have ulcerations, there's some other factors here that could disqualify you from this treatment. But that said, you possess a secret that most people don't have, and that is that you can control your nails with this process as long as you know the factors. Is there anything else you want to tell me or the people out there that are listening to this that might be helpful for them?
I think what I would say is for me, not having my nails look and feel the way they did before is a miracle, really. I mean, I can't thank you enough for sharing the protocol online because that's how I found out about it. And I just was feeling really hopeless about it. And I really thought I'd probably have to live with it for the rest of my life. And I'm so thrilled now to be able to feel like, my feet look healthy. That I can wear open-toed shoes. I can wear sandals. I live in the South and, it's hot here most of the year. So it's really a pleasure to be able to live and have my feet be like most other people's, and it is a lot of work. I would say that. But if if a person is really determined, it's possible. I'd say anybody can do it if I could do it. So I really want to really say a big thank you to you.
Well, big thank you right back at you. It makes me feel good. It's a Saturday, it's raining in St. Louis, and you're brightening up my day. I appreciate you and the fact that you're willing to come on and let other people know and try to help other people make the decision to do this. Yeah, I'm always one of the factors when it comes to consults is, and I always tell patients this: once a patient reaches out to me for a consult, I'll be there for them. In other words, you have my email address. I always say no news is good news, but anytime you need me, I'm right there. And you can email me, and almost in real time, I surprise people. I'll get back to you with an answer to a particular question or problem you have. In your case, thank you so much. I really appreciate it.
You bet.